We're all set.
Okay, so Patrick Chima. I'm a medical student at St. Lucia, the American Medical University. So today I'll be presenting on hydrocephalus. So we're going to look at the content of the presentation. We have a definition, a case, the epidemiology. We'll talk about the ventricular system, cerebrospinal fluid, types of hydrocephalus, the causes. We'll look at a few clinical presentations, diagnosis and treatment. So first, we look at a case, an interesting case of hydrocephalus. So a 12-week-old female infant presents to the emergency department with progressive vomiting, lethargy, and difficulty feeding over the past 2 days. Her mother reports that the infant has been increasingly irritable in the last week and does not appear to be herself. She has been less interactive and her cry has become more high-pitched and weak. She has not been breastfeeding well. Additionally, her mother is concerned because she thinks her infant's head has grown and a soft spot is present on the head. It appears fuller on the head. She thinks that the infant feels warm, but she has not measured the temperature with the thermometer yet. The infant has had a few wet diapers and no bowel movements. She reports that the infant was born on time and there was no prenatal or perinatal complications. The mother's prenatal labs were normal, and on examination of the infant, the weight was 4 kg, which is 5th percentile for her age. She measured 57.8 centimeters in length, which is 10 percentile for her age, and her head circumference was 48 centimeters, which is the 25th percentile for her age. So now going into the presentation for today, we'll look at the definition of hydrocephalus. According to the National Institute for Neurological Disorders and Stroke, hydrocephalus is an abnormal accumulation of cerebrospinal fluid in the ventricles of the brain. This causes an increased intracranial pressure in the skull and a progressive enlargement of the head. Talking about the epidemiology of hydrocephalus, I found some interesting facts about hydrocephalus. Nearly 400,000 new cases of hydrocephalus will develop worldwide, and the great burden of the disease falls on Africa, Latin America, and Southeast Asia. Secondly, 1 out of 770 babies will develop hydrocephalus, making it as common as Down syndrome and more common than spinal bifida or brain tumors. So basically, it's saying that hydrocephalus is more common than spinal bifida and brain tumors. A study conducted by the National Institute of Health states that the prevalence of hydrocephalus is...
Camera is covered. Oh, screen?
The screen is covered?
No, it's fine. It's fine.
Okay. The prevalence of hydrocephalus is 77% in pediatric population, 13% in the elderly population, and 10% in the adult population. So it's more common amongst the infants. So we're going to look at the anatomy of the ventricular system. The ventricular system in the brain, it's the reservoir for the production and the flow of CSF. It comprises of 4 interconnected ventricles. The ventricles are aligned by epidermal cells and are filled with CSF. So epidermal cells are like epithelial cells of the neuronal tissue. So we have four ventricles in the brain: the right and left lateral ventricles, the 3rd ventricle, and the 4th ventricle. So we look at the structure of the ventricle. So the main things to note in this diagram is the connection between each ventricle, the foramens. If you look at the top of the screen, we have the connection between the lateral foramen and the lateral ventricle and the 3rd ventricle, which is the interventricular foramen of Monroe. The connection between the 3rd ventricle and the 4th ventricle, which is the cerebral aqueduct. Then if you look at the bottom right of your screen, you see the connection between the 4th ventricle and the subarachnoid space, the foramen of Magendie and the foramen of Luschka. Then the 4th ventricle is directly connected to the central canal of the spinal cord. So this also illustrates the flow of spinal fluid through the ventricles. So secondly, we look at the cerebrospinal fluid, a brief anatomy of of cerebrospinal fluid. The normal amount of cerebrospinal fluid is 150 mils. CSF is produced by the choroid plexus, which are present in all ventricles. It's also absorbed by the arachnoid granulations or arachnoid villi, which is present in the subarachnoid space. That's where CSF is absorbed from the ventricles into the venous circulation. So normally, 50 mils of CSF is produced every day, and an equal amount of CSF has to be absorbed. So 500 mils of CSF is produced every day, and 500 mils of CSF is absorbed every day. So looking at the flow of the CSF circulation, you see the lateral ventricles through the foramen of Monro, the interventricular foramen of Monro, it goes to the third ventricle, then through the cerebral aqueduct, it goes to the fourth ventricle. Then from the fourth ventricle, there's a connection to the central canal of the spinal cord and the subarachnoid space where CSF flows to be absorbed. Yeah. So we're going to look at the types of hydrocephalus. We have the non-communicating or obstructive hydrocephalus. This results from an obstruction in any of the foramen, in any of the connections between the ventricles. In non-communicating hydrocephalus, there's an enlargement of the ineffectively drained ventricle. So in this condition, one ventricle that has been ineffectively drained, or one or two of the ineffectively drained ventricles can be enlarged, not a generalized enlargement of the ventricles. So the second type of hydrocephalus is the communicating. This results from an impaired CSF absorption. It has to do with the arachnoid granulations. The absorption of CSF is impaired. There's enlargement of all ventricles. So looking at the other types, we have rare types of hydrocephalus, like the normal pressure hydrocephalus. This is common amongst the elderly population. There's a dilation of the ventricle, but the pressure of the cerebrospinal fluid is not really high, or they say sometimes it's high intermittently. It's classified by a triad of dementia, urinary incontinence, and gait apraxia. Gait apraxia is an inability to or difficulty to initiate movement. So we have the second rare type, hydrocephalus ex vacuo. This results from neurodegenerative diseases. They're said to be a dilation of the ventricles and atrophy of the brain. It can also be seen in traumatic brain injuries. So we look at the etiology, the causes of hydrocephalus. We have congenital causes. Hydrocephalus can occur as a result of intrauterine infections like rubella, toxoplasmosis, cytomegalovirus. We all know the touch viruses that could cause infections in utero and stuff. It can occur from brain trauma to the brain during childbirth, which is more common in premature childbirth. We have cerebral aqueduct stenosis. That's a congenital condition. Chiari malformation is a prolapse of the cerebellar tonsils down the spinal canal. Then we have a Dandy-Walker malformation. Dandy-Walker malformation is a cystic dilation of the fourth ventricle and agenesis of the cerebellum, which is also a congenital condition. So the second cause of hydrocephalus is acquired hydrocephalus. Conditions like meningitis, intracranial hemorrhage, interventricular hemorrhage, brain tumors, arteriovenous malformations, ruptured aneurysms, degenerative atrophy of the brain, venous thrombosis can all also cause this condition. So we look at the clinical presentations. Hydrocephalus can present differently with age. And yeah, with age. So in infants, we can see conditions like head enlargement, the bulging of the frontal fontanelle, and prominent scalp veins. There's poor feeding, irritability, reduced activity, vomiting, Marquand sign. Marquand sign is seen by after the percussion of the skull. It's said to make a resonant sound or a cracked pot sound when you percuss the skull of the baby. So that's a Marquand sign. Then sunset eyes is a bulging eyeballs with a downward gaze. So that's what they call sunset eyes, sorry. So we can also see seizures in infants. So clinical presentations in children and adults, slow mental capacity, headaches, neck pain, vomiting, blood or double vision, which can be as a result of papilledema because of the increased intracranial pressure, drowsiness, difficulty walking and limb spasticity, urinary incontinence. So these are pictures showing the clinical features in a baby. So as you can see at the top of the screen, there's a large head and soft fontanelle, soft spot on the fontanelle, like there's a bulging fontanelle, prominent scalp veins, the sunset eye, which is a bulging and downward gaze of the eye, and the increased head circumference. So basically, these are the most common features, clinical features seen in hydrocephalus. So looking at the diagnosis, how do we diagnose this condition? This can be diagnosed with a CT scan to assess the size of the ventricles, the MRI scan, which can help us identify tumors or chiari malformations, ultrasound, which can identify intraventricular hemorrhages or intracranial hemorrhages, score radiography, lumbar puncture to check for the opening pressure, fundoscopy to check for the papilledema in the eyes, and intracranial pressure monitoring. So treatment in hydrocephalus, the surgical treatment are more effective, but for mild conditions of hydrocephalus, certain medications can be taken, like a diuretic furosemide, a loop diuretic. Acetazolamide can also be taken to reduce the production of CSF. For surgical treatment, the most effective form of treatment is shunts. We have different kinds of shunts, ventriculoperitoneal shunts, ventriculoatrial shunts, and lumboperitoneal shunts. Basically, these are shunts from the ventricles to the peritoneum, ventricle to the atrial, and the ventricle to the, and from the lumbar spinal canal to the peritoneum. So there's a picture showing how the shunt looks like from the enlarged ventricle, or tube is placed in the enlarged ventricle to drain excess CSF down to the peritoneal cavity in this case, to reduce the pressure on the head and symptoms of the hydrocephalus. Yeah. These are my references. Thank you very much. Hello? Okay. Let's stop this time. So feel free to ask any questions if there's any doubt or questions you might want to ask.
You can stop the recording first.
You said?
You can stop the recording first.
I don't think I'm the one doing the recording. I ended the screen sharing.
I guess Dr. Stein is disconnected.
Yep.
Yeah, I think so.
My internet went down. I'm sorry. I'm going to switch to a hotspot. Maybe it'll be better. When I go down, did the presentation go down at the same time?
No, I don't think so.
No.
Oh, great. Yeah, that's wonderful. Well, that was a wonderful presentation.
Thank you, Dr. Stein.
Unfortunately, I recorded it on the cloud, so we won't get lost.